Welcome to the Alberta Dental Association and College Reprocessing Learning Module 2. During the next few minutes, you're going to learn about the proper procedures to follow for cleaning used dental devices and preparing clean dental devices for sterilization. Manufacturers' instructions for the use of all products and equipment must be available and followed. Equipment in the dental office is to be considered a medical device and must be suitable for its intended use.
Meticulous cleaning is the first and most important step in reprocessing. Cleaning always precedes disinfection or sterilization. The cleaning process includes sorting and disassembly of dirty devices, washing, rinsing, drying, and inspection. All dental devices that are set up during a patient visit, including devices which were set up but not used, are considered contaminated and must always be handled in a manner which provides protection to dental healthcare workers. At the completion of each procedure, initial cleanup should occur in the operatory.
Visible soil should be removed from devices during and at the completion of the procedure, prior to transport to the reprocessing area. Blood and other body fluid should be removed with a damp cloth or gauze, not with alcohol. This practice helps to prevent the soil from drying on the devices and makes reprocessing easier. An example of this is the removal of composite. According to some device manufacturers' instructions, composite should be wiped off the device immediately after use using an alcohol prep pack. This prevents the hardening of composite on the instruments and allows easier cleaning.
Disposable sharps such as needles and blades should be discarded in a sharps container at the point of use in the operatory. This will decrease the risk of sharps injuries in the reprocessing area. Burrs are considered sharps and should be discarded in the sharps container. Following initial cleanup, trays should be covered and transported to the reprocessing area's designated soil receiving area. If you're not able to clean the used devices immediately, they should be kept moist until reprocessing can be completed. This can be achieved by covering devices with a foam or gel product intended for this use, or placing them in a holding solution intended for this use. Saline should never be used as a holding solution, as it will corrode instruments.
For devices that are soaked prior to cleaning, soaking should occur for the shortest time possible, as prolonged soaking can result in damage or lead to the development of biofilm that can protect organisms from sterilization. Dental devices must not be left soaking overnight.
Depending on the setup at your reprocessing area, you'll either be cleaning devices manually and using an ultrasonic cleaner, or operating an automated instrument washer. When using an automated instrument washer or washer disinfector, the manufacturer's instructions for installation, use, and maintenance must be followed. Household or commercial dishwashers are not appropriate. When manually cleaning devices in a sink, it's important to minimize the generation of splashes and aerosols. It's also important to follow the instrument detergent or enzymatic cleaning product manufacturer's instructions for dilution and use. These are usually written on the label or on the accompanying product monograph. This means that cleaning should be done under the surface of the water using a long-handled brush and low sudsing and free rinsing instrument detergent or enzymatic cleaner rather than under running water. If only one sink is available for cleaning instruments, drain and rinse the sink and refill with clean water. Then rinse devices below the surface of water prior to placing the devices in a clean drying area. If two sinks are available, one sink can be used for cleaning and the other can be used for rinsing instruments. Brushes and other tools used for manual cleaning must be single-use disposable or cleaned and sterilized after each use. Reusable brushes must be regularly inspected and discarded when damaged or worn.
Cleaning accessories must be stored in a location that allows them to remain clean and dry when not in use.
Visible soil shall be removed prior to devices being placed in an ultrasonic cleaner, as heavy soiling interferes with the ultrasonic cavitation process. Household cleaners, dish soaps, or hand cleaners are not acceptable as cleaning agents for dental devices. Ensure devices are completely immersed in the cleaning solution, and ensure that the lid is closed to prevent splashing and aerosols. The cleaning solution in an ultrasonic cleaner must be replaced daily or more frequently if the solution becomes visibly soiled or if the manufacturer's instructions specify more frequent changes.
Soiled instruments must never be stacked or soaked in the ultrasonic cleaner. The ultrasonic cleaner must be tested for cleaning performance according to the manufacturer's instructions, or at a minimum once a week if no instructions are provided. The results of this testing must be logged.
After the ultrasonic cleaning cycle has completed, all devices must be thoroughly rinsed to remove loosened soil. Rinsing must be done using clean tap water and under the surface of the water, not under running water, to ensure removal of all residues and to prevent aerosols. Devices with lumens or channels must be thoroughly flushed following removal from the ultrasonic cleaner.
There have been reports of adverse patient reactions to the cleaning chemicals when devices have not been adequately rinsed.
Upon completion of the cleaning process, remove all PPE, perform hand hygiene, and apply clean gloves prior to drying, inspecting, and packaging the instruments for the sterilization process. At this point, the devices are clean but not disinfected. Prior to being packaged for sterilization, devices must be inspected and dried. Devices are inspected for cleanliness, functionality, and integrity. If the instrument is not clean, the cleaning process must be repeated. If defects are noted, the instrument must be removed from service and either repaired or replaced.
Drying is an essential step in reprocessing as it prevents microbial growth and protects instruments from staining and corrosion resulting from exposure to minerals in tap water. Microorganisms can grow on moist surfaces and form a biofilm, which can be difficult to remove once it is formed. Biofilm can protect bacteria from subsequent disinfection or sterilization. Drying also helps fight corrosion of delicate instruments.
Devices which require lubrication should be lubricated following completion of cleaning. The use of lubricant must be compatible with the device and the sterilization process. The next step in reprocessing is the wrapping or packaging of clean and dry devices prior to sterilization. This task should be completed in the clean section of the reprocessing area. Wrapping materials must be stored in a place that is protected from contamination. The type of wrap chosen will be influenced by the manufacturer's instructions for both the wrap and instruments. Dental devices can be wrapped in either single-use paper plastic peel pouches or single-use non-woven wrap.
Points to consider when choosing type of wrap include size and weight of devices to be packaged, including the number of devices placed in each package, ease of placing the devices in the packages, easy removal of the devices from the package to maintain sterility of the devices, the ease of sealing the package, ease of determining if the package has been opened, damaged, or otherwise breached. Packaged dental devices must be stored in a manner that maintains package integrity and prevents package contamination. The manufacturer's instructions for the use of non-woven wrap should indicate whether single or double wrap is required and must follow the recommendation of the Canadian Standards Association. If there is no validated information which supports the use of a single layer, packages must be wrapped using 2 layers. The layers may be wrapped sequentially or consecutively.
Regardless of the type of package used, there are certain requirements that must be in place for all sterile packages. All packages must be sealed. Peel pouches must have seals that are smooth and intact. Devices must not place stress on any of the seams or the seal of the peel pouch. Non-woven wrap must be sealed with tape that has been validated by the manufacturer for use in a steam sterilizer. If non-woven wrap is used, it must meet the following requirements. Be flexible enough to permit sealing, wrapping, and unwrapping with minimal memory. Produce no lint or particles. be resistant to tears, and not leach or deposit toxic substances or non-fast dyes on the product. All packages must have a Class 1 chemical process indicator on the outside of the package. Process indicators are used to allow a visual check that the package has been through the sterilization process, but do not provide any assurance of the success of the sterilization process. All packages must have a Class 4 or 5 internal chemical indicator. The indicator must be placed inside the package in an area considered the most difficult for the steam to penetrate.
If the package of devices is intended to be used in conjunction with implantable devices, a Class 5 indicator must be used.
Chemical indicators do not test for sterility. They provide information on whether or not the conditions to achieve sterility have been met within the package. Integrity of the seal should be checked prior to sterilization, following sterilization, and before final use. All packages must be dry and cool to touch prior to handling and storage. If the package seal or integrity is compromised, or if the package is wet, the items must be removed from the package and reprocessed.
The number of devices placed in a package may need to be reviewed and decreased if packs are wet or package integrity is compromised following sterilization. The correct method of wrapping provides a barrier to contamination and preserves the device's sterility until it's used, and allows for sterile presentation of the devices. All packages must be labeled with a date and load number. If more than one sterilizer is being used in the office, packages must be labeled each with its own sterilizer number. Labeling of packages must be done in a manner that will not compromise the package integrity. This can be done with a soft tip marker that has been validated for use in a steam sterilizer or with an approved label applier. Regular date stamps are not suitable for labeling these packages.
Peel pouches and single-use non-woven wrappers must never be reused. To learn more about the different classes of internal chemical indicators and proper procedures for sterilization, please proceed to Module 3. Thanks for watching.